the treatment that you need to give in these CKD patients is, like, in order to reduce the uremia, what is that you need to do? That is the hemodialysis. And this hemodialysis is mainly required in case of end-stage renal disease. That is, in CKD stage 5, you require hemodialysis that will take out the uremia. And the diet, it should be phosphate restricted diet, because these patients, they already have the hyperphosphatemia. So phosphate restricted diet and avoidance of aluminum containing phosphate binding antacids. Now, along with that, in these CKD patients, like, provision of adequate calcium intake by mouth. And how much should be that calcium in CKD patients? That is nearly around 1 to 2 grams of the calcium by mouth should be given. Okay. And if at all, if you are giving the vitamin D, that is your calcitriol, which is the active form, the dosage should be around 0.25 to 1 microgram per day. Right, 0.25 to 1 microgram per day calcitriol is being supplemented. What is the aim of the therapy? The aim of the therapy is to restore the normal calcium balance, right? So once you achieve the normal calcium balance, that will prevent the osteomalacia, right? And that will also prevent the severe secondary hyperparathyroidism. So your secondary hyperparathyroidism and as well as the osteomalacia, right? So this can be prevented by maintaining the normal calcium balance. Okay. And it is usually recommended to maintain parathormone levels. So how much should be the parathormone levels? That should be maintained. That should be in between 100 to 300 picograms per ml. That is what is the parathormone levels that should be maintained. Okay, so your calcium balance, whatever you are giving, that should prevent your secondary hyperparathyroidism and maintain the parathormone levels between 100 and 300 picograms per ml. Now, next to this, like, you need to give the phosphate binding agents. Right, phosphate binding agents. So what are these phosphate binding agents? They include the sevelamer hydrochloride. So this sevelamer hydrochloride, that will reduce the phosphate levels in end-stage renal disease. But their use in early CKD stage does not seem to be beneficial in lowering the blood phosphate levels. Okay. So, right, this will be used only in cases of late stages of the chronic kidney disease. So this is about your CKD.